All right. Thank you. Thank you. I would hazard to say, and I am not a betting person, that no one has ever called Michael Fox lame and meant it. So just saying now. So I don't think that would ever happen. And if it does, you let me know who that is. So I am really pleased to be with you all today. I am Sharon Custer. I have a full-time job at Miami University in our administration and working in the president's office with partnerships and government relations. But prior to that, my background has all been in school-based social work and working. Even prior to being at Miami, I was at a local ESC doing wraparound and a lot of school advocacy. I've worked for our school-based center of excellence at Miami and was pleased to think about ways to talk about how you can collaborate with schools. You don't have to work for a school to be a really solid partner with schools. And wanted to share just a little bit of information about schools today. I'll be honest, I was all over the place in presenting this because as we sit in these presentations every couple weeks, I recognize how much special education needs often aren't being met in the teams and how many of you are struggling to communicate and to advocate. So I wanted to put a little bit of that into this. But we could probably do 4 hours of that on another day. So this is just going to be a very quick snippet of kind of looking at just some common definitions and some of the rules. I also want to say, since this is being recorded, that some of this is in flux right now and may be changing in the short or long term. So obviously we'll update our resources accordingly. But many of you, I'm sure, have heard of IDEA and thinking about what does that mean for individuals with disabilities, especially as it relates to school. And one of the biggest components of IDEA is the FAPE, the Free Appropriate Public Education. And that means that the every student is entitled to receive education at no cost to the caregiver. The appropriateness can sometimes be a little up for interpretation depending on who you ask, but it really is about designing educational resources that best meet the students' needs by implementing reasonable accommodations and interventions. We can't, give every single student a one-on-one PhD level educator, but we also need to recognize that some students need a little bit more support than others in order to be successful. The public education component is around really your district of residence. If a parent chooses to put their child in private education, it does change the dynamics and the rules. If the school says we can't meet their needs and we want to pay for a private education, that's a different situation. And one of the things that we often forget about with the young people that we serve is education isn't just about reading, writing, arithmetic. Schools are required to think about future employment skills and independent living skills, which frequently comes up in these echo sessions. So I want to make sure as you're thinking about how do you support a team, and even today's young person, we should be thinking about like those transition planning and what does life after 18 look like for all of the students we're working with. The other common term we hear is the least restrictive environment. Legally, schools are required to keep students in the place that is the least restrictive. And sometimes we do see schools go from 0 to 100. Or sometimes we have teams that say they need residential treatment, and the schools are like, whoa, that's not really the least restrictive on our end. And so making sure you're collaborating with schools and sometimes advocating is really important on that side. I put a few different definitions or just some common themes of the differences between an individualized education plan and a 504 plan. Essentially, the IEP is going to be much more comprehensive. It's going to have assessments. It's going to have not only the interventions and accommodations, but it's going to have the goals that the team is setting, how they're going to monitor it, how they're going to amend it and update it, how they're going to communicate those. And then again, that transition to work planning in Ohio, that typically starts around age 14. It can go up through their 22nd birthday. It can start younger. But right around 14, if you're working with a school district or a young person and they don't have any kind of transition talk in their IEP, ask about that. See what they're thinking, because often those resources can sometimes give that team and that young person excitement and hope about what the future is going to be like. And maybe school wouldn't be so scary or so bad if they had those resources. A 504 plan is similar in some regards to an IEP in terms of there can be accommodations, but it's much less rigor in terms of the assessments and the tracking. It's usually about how do we keep this young person to be able to be in their general education classes. So it could be an accommodation like they need to be in a place to take tests that doesn't have as many distractions or a little bit more time to take tests, or maybe they can take notes on their computer when everyone else is writing. So it's not nearly as formal and doesn't have the same criteria in order to get an IEP. But today, I want to make sure we're also talking about student assistance programs. So SAP is what you might hear. And the SAP model has been around for a while, but in 2020, the Ohio Department of Education and the Ohio Department of Mental Health and Addiction Services reached out to Miami University and said, we know that COVID had a strong impact not only on student mental health, but on school staff mental health. And we would like your help in building a model student assistance program that any school in Ohio, whether it's private, public, K-12, K-5, online, any school in Ohio can utilize the resources to make sure that young people and the school staff are getting what they need to be successful. And that created the School-Based Center of Excellence for Prevention and Early Intervention, which is housed at Miami University. And at the very end, I will make sure that you not only have the slides, but there's a QR code that can give you access to their website and a little bit more information if you want to learn more. But the goal of the COE was to really make sure that not only school staff, but caregivers, parents, and school partners have the tools and the resources, and the information that they need to ensure that all young people who are school age and beyond can be successful in what they want to do. And they've developed multiple programs, including their Model Student Assistance Program, which they piloted with, we started with about 70 schools across Ohio. And have done different iterations of that. And some schools have done the whole model, and some schools have said, we can't do it all, but we want to do this, and maybe we'll get to that later. And the data is showing that the schools that are implementing a model student assistance program have reduced office referrals. You can see these increased mental health services, increased staff wellness. Behaviors are going down in terms of reporting of substance misuse, and young people are more excited about their future. So we know that this model is making a difference. So many of you are not working in schools and don't have the opportunity to influence whether or not schools do assistance programs, but you do have the opportunity to partner with schools. And that's what I wanted to focus on today. So if you think about what a student assistance program should involve, it really has a lot of everything. And you can really start at anywhere in the circle. I'm going to start at the bottom just because it's an easy place to start for me. Like I am Julie Andrews there, a very good place to start, right? But you want to build awareness. Thank you, Mike. I appreciate the smile there. You want to build awareness about what is mental health, what is substance use prevention, what is suicide prevention, what is gambling prevention, what is sexual health prevention, what is all of those areas, right? We want people to be aware. We want people to be talking about it. We want people to know what the signs and symptoms are. You're creating prevention programming. And this is, for those of you who aren't familiar with tiered systems, but this is showing that all students should be receiving some levels of this in some regard. Tier 3 is typically who we are seeing in these ECHO sessions. These are the students that have more complex needs, that have multi-system involvement, that need really intensive supportive services. But the reality is all students can benefit from these areas in some capacity. The other part of a student assistance program, which could entail some of your involvement, is we want to identify before it's a problem when students might be at risk for something. So just like we're doing lots of screenings for vision and dental, hearing, we're encouraging schools to do universal screening for mental health. And a lot of times they say to us, we don't have enough people to help with that. This is a great place where you can partner with the school and say, if you want to do universal screening days, how can we be assistants? Some schools do these during family engagement night. Some schools do them during a course of a week. And they've got a lot of different tools that are easily to be trained on that you could help to say, this child is flagged. We've noticed this. We'd like them to get additional screening. But sometimes they do need extra trained professionals to help with that. It also includes making sure that there's appropriate evidence-based interventions available. We don't want to just kind of haphazardly throw different resources out there. We need to make sure that they're culturally responsive, that they're trauma responsive, that they're really designed to meet the unique needs of each student or student group. A good student assistance program has a really robust referral system, and not an intensive one where you have to fill out 30 pages and have to know every little diagnosis, or you have to fill out the cans in order to get support. But it should be something that says if a bus driver is concerned, they know where to go so that the student gets the help that they need. So often referrals to school counselors or social workers or other mental health therapists come from like running into somebody down the hall or some major event happens. But if you have a referral system where peers can refer each other, where colleagues can refer students, and again, where parents and caregivers can refer, it really does help to get those early identifications going. And then once you create whatever that intervention is, it should be followed up. It should not be a one and done. It should be, do they need more? Do they need less? And how are we tracking and monitoring how things are going? So a solid student assistance program has a team that's working on this regularly, that's checking on the student's progress. They have someone coordinating all these areas, and they're partnering with agencies and services outside. So here are some of the elements that make up a quality student assistance program. We've talked about a lot of these already. It does look at different disciplines. It's not just the school counselor, the psychologist, or the social worker. It's bringing in potentially a coach or a nurse or a cafeteria worker, or again, a bus driver. Like they're the ones that see those students at the very beginning and the end of the day, and they often hear things that people don't realize. And getting their perspective is often really, really helpful. Um, it looks at not just cognitive areas of learning, but what are the other aspects that are impacting. It tracks data so that we can say, you know what, we're seeing trends that more and more students are having grief and loss, or more and more students are struggling with peer relationships or dating relationships or gender identity needs, or wherever the themes are going. How do we create, either create internally at the school, or again, partner with an outside entity to say, we need your help on this. Is there anything that you can do to support our students and our families in these areas? It should have a really strong family community involvement as well. We don't want to create services and resources with family without family input. And so that's a really big part of it. And it looks like Brianna, am I saying that correctly? You have a question? I know I'm
No,
talking.
it's Brianna. I just wanted to know if
Brianna.
the slides would be available after we are done. Okay,
Yes.
perfect. Thank you so much.
Okay. So when we look at um, different models of how, whether you're a school or an agency, these are two pretty commonly used models across Ohio. The first one is a strategic prevention framework, a national model that looks at typically communities and how are we going to define what the needs are, what is our capacity, what are we going to implement. And then on the right hand side, you have the Department of Education and Workforce's school improvement process model, which asks schools to say, what are our needs? What are we offering? What do we need to do? How are we going to adjust? And while these are great for macro, they're also really good for looking at students on an individual level too, like doing that process that we already talked about. So what I wanted to do, I know we've got just a few minutes left because I do talk really fast, but I also know Mike will cut us off if I go over. It's my fear of the week, right? I want to think about what is it that you can do to partner with schools to be effective. So I probably should have been more savvy and done these bullets as they come up, but then I get distracted. So I listed some barriers to collaborating with school, and we're going to start with a negative, even though I'm usually a pretty strength-based person. But I want you to add to these in the chat. And I don't even know if I'm not good about having the chat open. I got to find it again on there it is. Okay. Um, so, some of the things that come up in how to collaborate with schools, the family doesn't always trust the school, and sometimes rightfully so. When I was doing my work with wraparound, I went to hundreds of IEP meetings, and I can't tell you how many families said to me, they were nice to me because you showed up, or this is the first time they were nice to me. So a lot of times families don't have their own positive experience with their own school. And so just walking into a school for their own child brings up all the memories of what it was like to be in school and not be happy. Or even if they did have a positive experience as a student, you can be the best parent in the world, but if you have children that have any kind of special needs, you are constantly being judged. People are questioning you, you're questioning yourself. And again, I love school-based work, and I have a lot of friends who are teachers. My mom is a teacher, and I even had to sometimes say to her, "Mom, if I were the kid you were talking about, would you tolerate the school talking about me this way?" And reminding ourselves that sometimes that we aren't very good to families. And so if the family doesn't trust the school and the school doesn't trust the family, it's hard. So you are in a unique position sometimes to be that bridge and that liaison and support both sides and to make sure families' voices can be heard. We also know that some of the barriers are sometimes schools say we can't talk about that, or Children's Services says we can't talk about that. And so there's not good communication sharing, even with the right releases of information, or the opposite happens. I've worked with a lot of school districts that tell me things that I have no business knowing about a young person, especially even with the release. I'm like, I didn't need to know that. That's not pertaining to me. And there's different standards of that, and that creates some other issues. Oftentimes schools say, well, we've reached out to children's services and we've reached out to the mental health agency and they don't do anything. So what's the point? They give up. Or the opposite. Sometimes the agencies say we've tried to reach the schools and they won't talk to us. I see in the chat we've also talked about just that outside professionalize the situation advocacy is yes, I appreciate that. Just being there. Yeah, absolutely. Sometimes people feel like they have to be on their best behavior when we show up, even if they don't do it, we don't do or say anything. Um, the schools I've worked with over the years, especially when placements have come up, a lot of times, a team will say, we think this child needs residential. We think they need this. And the school's like, whoa, we still have to pay for that schooling. And you've just made a huge commitment without even asking us if we think this is what's best for the child. And you just assume that your needs are more important than the educational needs of this child. And you're not even including us yet expecting us to pay. And a lot of frustration on the school's part because of just assuming that they're just an open checkbook with no insight. A lot of times we hear from families that they're in day-to-day crisis, and the idea of even thinking about going to school when they're actively suicidal, it just like you got to prioritize. And then we know that sometimes the school engagement, the more that happens, the harder it is to get that child caught back up. I've also heard that zero tolerance policies that keep students out of school. If I could see Marjorie's face, I'm sure she'd be nodding right now. How many times the school has called and said, pick up your kid, they have to leave, pick up your kid. They said this, pick up your kid, we're suspending them. Or like, no, you can't do that. They're on an IEP and their IEP requires you to have accommodations that doesn't mean that you can just not deal with it because you don't want to, but it does create some other barriers. So before we get into the strength side, are there any other barriers that I've missed? Feel free to just throw them in the chat. All right. Well, while you're thinking about that, let's talk about though that even though there's a lot of barriers and it's not always easy, there's a ton of benefits to collaborating with schools. When mental health or DD or children's services or prevention teams or even faith groups are able to collaborate with schools and we're working on the same goals, it's so much easier for the family. They don't feel like they're being told one thing over here and something else over here, and we understand what the needs are. We can divide and conquer. It really helps when we're all saying, like four of us don't need to be working all these things, or I don't need to do anything when there's also a case manager or a school social worker that's willing to help me find some of these resources. Um, Schools have opportunities to impact youth in so many more ways than one individual agency typically can, right? It's not just traditional education. We know that they do OT and PT. We know they have mental health services, the social support that they give, the vocational opportunities that they can do. And so sometimes we feel like as mental health providers, we're trying to think of all these things when the reality is a lot of times schools can make a big decision or be a big supporter of interventions that help with all of these things. Oh, Tracy, I like that. The deficit driven assessments. Yes. It's awful to just be reminded that you don't know how you're doing something or things aren't working well, and nobody wants to be reminded of what's not going well. Um, I put families may feel their voices are heard because just because we're collaborating doesn't mean we're treating families any better or that we're listening any better. So ideally, when you're collaborating and you're helping the families have their voices heard and you're advocating for them, that's working, but you shouldn't make assumptions. Sometimes it's the opposite and they even feel ganged up on because the professionals are all communicating behind the families' backs, and that's not the way to collaborate either. Um, it does build an empathy and awareness of sometimes whether that's what's going on at home, what's going on at school, what the mental health provider is going through, what the educators are going through. The more we understand each other's roles and responsibilities, the more we can support each other in a different way. And then looking at the big picture, when we understand some of those trends, like we talked about, we can create a coordinated system of care. So did I miss anything? Are there other benefits to collaborative schoolwork? Go ahead and put those in the chat. So we've talked about a lot of these already, but I wanted to give a couple concrete tips of things that you can think about, whether you're using a formal student assistance program or collaboration with schools in general. You can be a referral to different programs at school, or you might be the referral from the school. Schools often don't even know what's out there in the communities. They are, whether even a school, the best school social workers only know what they know, right? And if you are not at the forefront and letting them know that these resources exist, it's hard for them to connect with you. You might be helpful in getting assessments and identifying some of the needs for school programming or vice versa. Maybe you need the schools to give you some information so you can do a more comprehensive assessment of what's happening. We've talked about the importance of helping the youth or family tell their story, of being the person that can sometimes say, you know what, like mom, dad, grandma, why don't you tell us what you're thinking right now? Sometimes interrupting that pattern of talking over families and being an advocate for them can go a long way. Um, we've talked about the continuity of care and consistency, universal screenings we talked about, family engagement nights. A lot of times schools put on different resource fairs, and you could set up a booth and be there and let families know that your agencies exist in the community. Um, and then on the flip side, one of the things we didn't talk about a lot, but a really strong, robust school assistance program has a staff wellness component. We know that if we want our students to be well, our staff have to be well first. And so sometimes your role isn't necessarily always directed to the student, but we have a lot of mental health and prevention agencies that have come into the schools and said, what can we do for your teams to keep them healthy and making sure that they feel valued and they're prepared to take care of the kids. So the last page, and again, you'll get these, we'll share a little bit more information about what the School-Based Center of Excellence can provide. One of my favorite resources is relatively new. It's called No Wrong Door. And it is a catalog that will give resources for parents, caregivers, pediatricians, and school providers and partners some information. And everything on here is free. You can download them. And they're constantly adding more to it. If you want your information to be part of the catalog, it is free to have that on there. All that information is there so that you can add information if you are interested. And so with that, I will turn it back over to the never lame Mike Fox.